Hello, I'm Dr. Ina Rifkin with Thundermist Health Center. If you recently gave birth during COVID-19, we know it's not been an easy time. Now that your baby's in the world, you may have more questions than before about breastfeeding, nutrients for your baby, and resources such as WIC. Thundermist Leslie Lopez, a certified lactation consultant and peer counselor of WIC, and Elizabeth Warren, also a certified lactation counselor, are here to answer your questions about breastfeeding, chest feeding, and WIC services during COVID-19. This is a live event. Please type your questions into the comments during the live stream, and we'll do our best to answer them. We're excited to have one of our baby shower sponsors with us today. Yolanda of United Healthcare can explain how you can enter to win the grand prizes.
Hello and welcome. We are excited to announce the information about the raffle prizes and how to enter. The grand prize raffle items include a new crib, our car seat stroller combo, and baby monitor. So this is how you would enter. Watch each session live or recorded to get the link to enter our grand prize raffle. The link will be in the comments. We will share the link in the comments as well. Viewers have until Sunday, July 26th to enter to win. Winners will be announced Monday, July 27th on Facebook. As a sponsor of Thundermist, United Healthcare has a lot of rewards programs for moms who go to their prenatal appointments and also their baby's milestone appointments. If you have any questions for us, please leave them in the comments. Enjoy the event.
Thank you, Yolanda.
You're welcome.
Now let's hear from our lactation counselors, Leslie Lopez and Elizabeth Warren. To just start us off, why don't we talk about, is it safe to breastfeed during COVID-19?
There's a lot that goes into that, but the short of the long answer is yes, it is safe to breastfeed during COVID-19. And later questions will kind of dig into some of the details.
Okay, so why should a new parent consider breastfeeding or chest feeding?
Breastfeeding and chest feeding have a lot of great benefits for both moms and for the babies. Of everybody's big importance during the pandemic is infection control and breastfeeding. Our new babies don't have fully functioning immune systems yet, but breastfeeding gives them all the extra protection of their mom's immune system by passing antibodies from the mom through the milk to the baby. Breastfeeding or breast milk is a perfect food for your baby and is the only food that your baby needs for the first 6 months. Breast milk's pretty interesting. It constantly changes to meet your baby's developing needs. From the very first days, so the very first milk is called colostrum. It tends to be thick and yellow and sticky and has like lots of great antibodies in it and everything to get your baby off to a good start. And as your more mature milk comes in, which you'll find it to be thinner and more like white, sometimes maybe a little blue or yellow, it will still contain all those antibodies, but as well as have all the nutrients that your baby needs to grow, calories and water and other nutrients. So some of the other great benefits for babies is breastfed babies tend to be sick less often. They have a decreased chance of developing chronic diseases later in life, and also tend to have a decreased risk of being overweight or obese. Some of the great benefits for moms is a lot of moms tend to have a quicker recovery to pre-pregnancy weight and post-birth. So you feel better sooner. You tend to sleep better overall due to some of the hormones that are released during breastfeeding. And you have a decreased risk of chronic diseases, such as diabetes and other diseases like breast cancer, ovarian cancer. And overall, once breastfeeding is off to a good start, it's really easy and a heck of a lot less work.
I want to agree with you, Betsy. Those are all really great point factors for mom to really want to initiate breastfeeding overall, especially in the hospital where they're going to get a lot of assistance with latching properly, and just understanding their milk supply it's a pretty big deal for me because it changes so much during the first month of their baby's life. And you mentioned colostrum, the first one that lasts for a couple of days, and then their milk matures and it transitions over to fore milk and high milk. And that's more of the proper milk that most women are expecting from day one. It runs a little bit better. It's actually white like milk. So they understand that part a little bit better. But those two milk transition back and forth so much in the need of their baby's nutrition. So fore milk is actually skimmier version of breast milk. It carries a lot of water to keep your baby well hydrated. And the hind milk is actually the fattier part. And that's what helps baby really gain weight, have their nice fullness and chunkiness to them. But another great reason is that it's actually mom's fat. And that's why they actually lose a lot of weight. They burn a lot of calories during breastfeeding. So they lose, so their baby can gain, which I think it's a really nice thing for most moms when they want to really lose all that baby weight. It's fantastic. The first month is just falls right off of you.
We have an excellent question from one of our listeners, and that is that my daughter will be 17 months by the time my other daughter is born in October. And is it okay to breastfeed both of them?
Yes, most definitely. Still great to breastfeed both of them. Milk does tend to change when there is a new pregnancy. Some babies will adapt to those changes and will keep breastfeeding. Others might not because of the taste difference in it, and that's okay. I still really encourage you to breastfeed for as long as you can, and the milk will change once the new baby is born, and the baby will still get like that colostrum stage that we talked about, and then transition over to fore milk and high milk. Some of the things that I've actually told my moms is that if the first baby does stop breastfeeding completely and wants to kind of start once the new baby is born, because they remember it, it's there, they see it, they kind of want to try it again, it's okay to do so. You can either latch them on, or you can actually pump and give it to them in a sippy cup, and that's really going to really boost their immune system again, and their brain development, especially if they're over a year old.
And they might just want to, just for the comfort of it, like their lives have been totally disrupted. There's a new baby on the scene, and mom's attention's not all on them anymore. So they might need that closeness, and that's a wonderful way to give it.
Exactly, yeah.
I do think this is a wonderful question. I agree with both of our lactation counselors. I would add that with the new baby, there are other needs. And the thing that you do want to make sure when you're tandem feeding a toddler and an infant is that the infant is getting the proper nutrition. So you may want to either give the infant a first go at the breast, or you also want to make sure that if you're doing the infant on the right breast one feed, then you're doing the other side, the other feed, so that the stimulation is similar on both sides, and to make sure that the infant is getting the proper nutrition. The breast milk that comes to the toddler is certainly helpful and has immune benefits, like was already mentioned, but they're probably getting most of their nutrition and their calories from other foods. Of course, the infant is getting all of their calories from the breast milk. But thank you for such a great question. All right. We know that lots of resources have been disrupted by COVID-19, but how can a new parent get help with breastfeeding during this time?
So there's still a lot of help regarding with breastfeeding, very accessible. Women and Infants has a warm line that you can reach. I can give that number out if you like. It's 1-800-711-7011. their warm line, you will have to call, leave your information and your question, and they reach out back to you within the 24-hour. I definitely want to say that I'm always available as well. If you call the WIC line, which is 767-4109, and just ask for the breastfeeding counselor, I'm more than happy to help anybody. And Landmark also has a great warm line, and their number is 01769-4100, extension 2218. And those are just for more immediate phone calls to kind of ask your questions. There's also the Rhode Island Breastfeeding Coalition that lists plenty of other places that you can call, like Kent Hospital, a couple of other places, the Baby Cafe, which is an organization that we used to hold this facility where we would just welcome moms from anywhere in Rhode Island, anywhere near Massachusetts, with breastfeeding too. So all of their information is in the breastfeedingcoalition.com. You can log into that and probably find whatever's closest to you.
Yes, and if you're at Thundermist West Warwick, you can always call and ask for the breastfeeding nurse, which is me, Betsy, and they'll get a message to me too, and I'll always respond.
I'll also add that for those of you who are patients of West Warwick or who plan to deliver at Kent Hospital, regardless whether you're a patient, the lactation consultants there do also have both a phone number, and they are seeing live consults for breastfeeding support, whether it's prior to delivery or after. So you can reach out to them as well. Excellent. Since this has come up a couple of times, Leslie, could you just clarify a little bit what WIC is and what services it provides?
WIC is a fantastic program that helps women, infant, and children's. The purpose of WIC is just to help moms' nutrition, make sure that they're eating okay throughout their pregnancy, that they're growing well. And for infant and children's, we offer a lot of services with breastfeeding and also formula. We do only work with the Similac Advanced brand. That's who we just contract with. And we also offer services to children under 5 years old. To qualify for WIC, we either go by income and household size, and if you have health insurance through the Department of Health of Rhode Island, that qualifies you automatically. We will ask other questions to kind of go with that, but that's usually a shoo-in to get into it.
Thank you. And are there other things that WIC can do to help moms and their babies?
Yeah, so we do a lot of referrals to different places depending on the need of the parent, but the biggest is nutrition. So we check their height, their weight, make sure that they're growing well. They meet with nutritionists every single time they come into the office, and just answer any specific questions or concerns. We keep close contact with pediatricians as well to make sure that we're following whatever the nutritionist really wants for the child or for the infant, especially with formula changes, sensitivities and allergies and things like that. We keep all that stuff into consideration.
Excellent, thank you. And Leslie has mentioned a whole set of different resources. We will have that information available for all of you as links on the chat, and the phone numbers will be posted there as well. So in case somebody didn't catch that, that will be available under the comments after the talk. All right. Other questions that have come up are about pumping and how are new parents getting pumps these days?
Okay, so the pump services is actually working different right now, obviously because of COVID-19. That I know of, women and infants is just requiring to have a prescription form filled out by your provider to be sent to the in-store site for pumps. You can actually do this process in the hospital when you first get in. Just talk to your nurses, ask them about the whole pumping situation, and this form gets sent out to their on-store site, which is located in the first floor of Women and Infants, and you actually pick up your pump if you do qualify for it, depending on your insurance. You go downstairs to the store and you pick up the pump before you leave. So this is a on your way out process. They don't give you your pump in your room. You have to just kind of pick it up and just kind of move along. It's a lot quicker. So I do advise that if you are picking up pumps and you really don't know how to use them properly, to either call your nearest WIC or just any of those other breastfeeding resources to kind of help you out working your pump properly.
Yeah, and if you're not using WIC or happen to not be delivering at Women and Infants and still want a pump, a really great thing is to reach out and contact your insurance company while you're still pregnant, if you still are, and find out what their requirements are for getting you a pump, because every insurance company is a little bit different.
Every insurance company is different. That said, the Affordable Care Act did provide for pumps to be covered by insurance companies. Insurance companies, depending on which company it is, will cover different pumps. So that's where contacting them ahead of time can be really helpful. As Leslie mentioned, most hospitals will help you obtain a pump while you're a patient there during the time of your delivery. You can also work through your insurance and your physician or your midwife to obtain a pump prior to delivery if that's your goal. And most insurances will cover one new pump per pregnancy. So even if you have a pump from your last pregnancy, you should be able to qualify for one. Again, every insurance is a little bit different.
And I think it's important just to add, like if for some reason you're separated from your baby, like your baby needs to go to the NICU or you're not always together with them, using a pump provided by the hospital, like one of their on-service pumps, is going to give you a much better start than using a home pump, because they're much better designed to help you build your milk supply while you have it available. And if need be, you can always rent them when you go home too, for a short while.
Yeah. And we have a follow-up question in our chat, which is that while the pump process is more clear, is anyone instructing moms how to use it before discharge?
I want to say that I do instruct moms in how to use the pump properly, depending on what they want. I have quite a few different models in my office to show them. I help them pick out the best pump depending on their need for it. But other than me explaining how to use one, I really don't know of any other places that might be doing that. So I do encourage moms to call WIC and just ask questions about their pumps, how to use it properly, because it's a pretty big deal. You have to know how to use it to get a good amount of milk supply out and not feel too stressed about it. I did want to add that if any moms are denied a breast pump through their insurance or for any other reason and they can't get a pump, WIC will actually help with getting a pump if you're fully breastfeeding, not doing any type of formula, are currently getting WIC. We will help in getting a hospital grade A pump rented out to you for the amount of time that you're actually breastfeeding. It can go up to a full year if you do decide to breastfeed for a full year, but I guess to contract that, like I said, you have to be fully breastfeeding and have had a denial from your current health insurance.
I will add that the lactation consultants in the hospital are frequently showing moms how to use their pumps. If you have your pump before you deliver, or if you order the pump while you're in the hospital, a lot of the time it'll get delivered to your room, and the lactation consultants and even the postpartum nurses and on the labor floors and the postpartum floors are very knowledgeable about pumps, and they will help you make sure that you have the right fit. And as long as you have that pump available, can help you with that. There's another great question coming from one of our listeners, which is, why is it easy for some moms to breastfeed their babies versus other moms who have a harder time but still want to breastfeed, and what can be done?
I just have to say, it's probably every mom is different and every baby is different. You can have a very easy time with one baby and have a really challenging time the next time. Some of it has to do with just moms. Some moms just produce milk more quickly than others. Some are slower than others. Babies are a little bit different. Some of them might have been positioned in utero so that their neck muscles are tight, and they just might be really sleepy or not feeding well at first and not want to, like, you might have to work harder to wake them up to get them interested in feeding. There's a lot of different factors that can go into that. But if you feel like you're struggling, I think the number one thing is to reach out to the resources that are out there, because there are people who can and want to help. And pretty much every problem is solvable if you're willing to stick with it.
I agree.
I would add that a lot of the time that early bonding and early feeding is crucial, but it can be very frustrating. And it can be frustrating when the baby is fussy or doesn't want to latch initially. But we have to remember that they don't really know what they're doing either when they first come out of the uterus. And having patience both with the baby and also with your body, and being persistent and reminding yourself to just give it some time is frequently the fixer. Just because you delivered a baby today doesn't mean your breast will be full of milk by this afternoon. It frequently takes several days for milk to come in, and that time can be anxiety provoking to new moms. But it is also a normal time, and it is a normal process to have the milk take some time to come in. So work with your resources, work with your floor nurses, your lactation consultants, your outpatient doctors and midwives and nurses and lactation consultants, and we could certainly try and help you reach your goals.
Yeah, and lots of skin to skin time. Just spend time cuddling with your baby. It helps them feel calm and ready to kind of give it another try, and it feels good to you too.
Great stimulator.
And I think we've addressed this a couple of times, but is there any other times where you should ask for help on breastfeeding?
I feel like when you're very anxious, milk supply doesn't seem like the best, and you're thinking about introducing formula, I really, really encourage you to speak to a lactation consultant, or again, call the WIC office. Either a nutritionist or I can help you out with that, because like she said, some of these breastfeeding little hiccups are very, very fixable in patients. Again, it's a key to all of it. Some of the things that moms don't expect, as a lactation consultant, I do expect, and it's normal for me to hear that from you, and just giving you the knowledge as in why that's happening. Like, sometimes not feeling like you have enough milk supply could be just that your baby is growing, having cluster feedings, and just feeding so often that it seems like you don't have enough, but it's actually the opposite. It's your baby knows and wants to stimulate your breast to make more milk because he or she is growing and they need a little bit more. And without that stimulation and consistent nursing, it's a little bit harder for your milk to actually catch up. It needs that stimulator to know how much milk to make. So hiccups like that are like easy fix, and just talking to somebody always makes you feel a lot better, because we're going to help you understand why that's happening.
Yeah, definitely. If you ever feel like you're not making enough milk, definitely reach out, because many times it's more of perception and not necessarily the truth, for some of the reasons Leslie was talking about. And talking to somebody, we can help tweak what's going on and figure it out. Is there really an issue, or is everything going great? Because sometimes when your baby wants to feed more and more often, you feel like, and understandably so, that you're not making enough milk, but you can be. Also, if you're ever like feeling any pain while breastfeeding, that's not normal. It shouldn't hurt while you're breastfeeding. If you are, please give a call. Those are things that we can help fix. If your baby's not gaining weight or sleepy all the time, other good times to reach out.
Thank you, Betsy, for bringing those up as well. I think from a clinical perspective, if your baby's not gaining weight or if you're having more pain, especially if you're having more pain when you weren't having it before, is a good time to reach out.
Yeah.
Also, keeping in mind mom's risks for mom, sometimes women with really good milk supply can actually have milk ducts. And that can be really uncomfortable for mom and may present a risk to developing mastitis, which is an infection of the breast. So if you're concerned about any of those issues, that's also a really good time to reach out to both of your lactation consultants and potentially your physicians or midwives to make sure that we're taking care of you as well as the baby.
Definitely.
Bringing this back a little bit to the current times we're living in, if you test positive for COVID, would it still be safe to breastfeed?
Yeah, that has been a big topic because COVID's been an entirely new situation for everybody, and we haven't really known a whole lot about it. There's lots of research already going on trying to answer some of the questions. But overall, yes, it looks like it's very safe to feed your baby, even if you are COVID positive for some. One of the things is some of the studies have shown that occasionally you do find some COVID virus particles in the milk. At this point, it's not fully understood. Are those transmitted from mom directly, or are they more likely the result of contamination, like during the pumping process or something afterwards? And it's also not known if those virus particles would actually be able to infect your baby, or if they could just be like little parts of the virus as it's kind of fallen apart. But what studies also are showing is that there are lots of antibodies to COVID made from mom in the milk. So that will provide protection no matter if there are virus particles in the milk or not. But if you are diagnosed with COVID, you do need to make a few changes while you're breastfeeding, just to infection control practices to decrease the risk of transmitting it to your baby. If this is the case, you're in the situation, since the recommendations are changing constantly as we're learning more and more, definitely be sure to talk about it with your care team at the hospital, and you can talk about your specific situation and come up with the best plan for you. But some of the options are you can go ahead and choose to feed right at the breast. And other ones are you can like pump or otherwise express milk and have a well caregiver give the baby the milk. Either way you do, it will be really important that you're wearing a mask so that you are not breathing on your baby, and that you wash and clean your hands each and every time before you touch your baby and get started. It may be possible that you may be separated from your baby if you're really, really sick and just not up for caring for the baby, that, baby's going to go somewhere where there's somebody who can like help care for your baby. And if you're kind of feeling like, okay, it's possible you might be separated from your baby anyways, depending on the situation, or you might even be in the same room, but the baby will be across the room, and hopefully have another well family member on hand to help take care of your baby.
This is a particularly anxiety-provoking time right now, especially for new families and new moms. We are working to try and come up with answers to a lot of these questions, but like Betsy mentioned, it's an active area of research and things are changing all the time, and a lot still remains unknown. For the most part, I agree with Betsy that breastfeeding does seem to be safe as long as we're taking appropriate precautions to avoid respiratory droplets on baby and to avoid exposing infants to high viral loads of COVID. There is some reassuring information in that very few infants have been sickened or symptomatic from COVID, but again, there is a lot that we don't know.
So, and the other thing is, like, if you are going to be pumping milk or otherwise expressing milk, but in this case, like with an electric pump, for somebody else to give your baby, it's really important to clean and sanitize your pump in between each and every feed. There are good handouts from the CDC available on how to do that, as well as I'm sure that each manufacturer has their own guidelines for it. But we have those available for you, at least the CDC one that we can hand out and walk you through the process if you need it.
We've been focusing mostly on breastfeeding since that is where our guest speakers' expertise lie. But how about more generally? What do babies need to be healthy?
Overall, babies, they need you to respond to them. They need you to answer their cries and their cues. Like when they're hungry, they want to be fed. When they need to be changed, they need to be changed. And despite some of the myths that are out there, you can't spoil your baby by holding them too much. At this point, they've always been carried around in your womb and you've always been there. And now they're in a whole new environment and they don't know what's going on. So it's okay. Your baby's probably going to want to be held all the time. And that's all right. Just use your infection control practices if you need to. Try to limit visitors, particularly now in COVID, if you were the visitors possible, just to keep them from being exposed to other things, and just love them up.
Leslie, anything to add?
So I would like to take a minute to say in Spanish how to enter our raffle for Thundermist. So this is all for our Spanish speakers. Estoy contenta de introducir que Thundermist está haciendo una rifa para todas las madres y todos los padres nuevos. Usted puede entrar al Facebook de Thundermist y va a haber un enlace donde usted puede poner toda su información y la oportunidad de ganar premios. Los premios consisten de una cuna nueva, de un monitor de bebé, un paciente y un asiento de bebé. Para más información, por favor, solo métase al Facebook de Thundermist. Encuentre el enlace en los videos que estamos promoviendo todos los días. El último día que puede entrar toda su información va a ser este domingo, julio 26. Gracias.
Thank you, Leslie.
You're welcome.
We do have another question from our chat here to follow up on the COVID positive moms. And the question is, if mom is tested positive at birth in the hospital, is she encouraged to manually express milk so that she could give colostrum via a spoon?
Like I said, it's changing all the time. I'm not quite sure what the current hospital policies are, but my understanding is that yes, as long as you're working with your mask on, so you're not having respiratory droplets going anywhere, and having clean skin and hands, you should be able to express milk to give by spoon.
From a physician who works in a hospital point of view,
yeah.
we are mostly recommending breastfeeding. Again, with the practices of hand washing and mask wearing. You can either, it depends on your situation, it depends on how sick you are and what your individual circumstance is. You may be able to directly breastfeed with those precautions in place, or you may be encouraged to manually express. And that certainly is a really good option, again, as long as hands are washed and the tools are cleaned in between use. Thank you for that question. I do encourage any of our listeners, if you have other questions, please write them in the chat so that we may address them. And of course, you can always reach us with the resources provided, and we would be happy to assist you. But if there are no other questions for now, I will say thank you to everyone, and we hope that you have enjoyed getting to know our lactation consultants and our sponsors, and that we were able to answer your questions. These live videos will be streaming on our Facebook and YouTube pages. If you missed any, be sure to check them out. Before you leave today's session, be sure to enter to win our grand prize raffles, and participants can look in the comments for a link to enter to win or visit the link provided. Today's session will be recorded and available to view in the future. Thank you to Neighborhood Health Plan of Rhode Island, United Healthcare Community Plan of Rhode Island, Tufts Health Plan, and Landmark Medical Center for generously sponsoring this virtual series. If you need prenatal or primary care, Thundermist offers services for all ages and does not turn anyone away due to ability to pay. Call us at 401-767-4100 to schedule an appointment today. Thank you so much.